So today in public health news, California has passed new vaccination laws according to Governor Jerry Brown on June 30th, 2015, on the most strict vaccine mandate in the United States. And the new health policy requires all school children to be vaccinated, and the state will no longer grant exceptions for the vaccination requirement.
So what does the law say? Private or public daycare centers, preschools, elementary, and secondary schools cannot admit children unless they have been immunized. And what did the law change? It eliminated the personal belief exemption, and this exemption allowed parents to opt out of vaccinating their children due to personal or religious beliefs by getting a form signed by a health practitioner.
What vaccines are required? There are 10 required vaccinations, including DTaP, bacterial meningitis, measles, mumps, rubella, polio, chickenpox, and hepatitis B. Are there any exemptions to the new law? Yes, unvaccinated children will still be able to attend school if there is a medical reason why they are not able to immunize. Reasons include prior vaccine reaction, history of seizures, family history of autoimmune diseases, child that has a autoimmune disease, an allergic reaction to the vaccine, genetic testing indicating evidence that a child will suffer vaccine reaction or autoimmune disease post-vaccination. Temporary exemptions because a child needs more vaccine than can be safely given in one visit.
So when does the new law go into effect? It will take effect in July 1st of 2016, but a personal belief exemption is still the law of the state and is valid for a private, public, or secondary school, daycare center, nursery, or development center until July 1st of 2016. So a personal belief exemption must be submitted to the school by July 1st for the 2015-2016 school year and is valid until the child advances to the next grade span or until they have moved into the next school or changes schools. And grade spans include birth to preschool, kindergarten to grade 6, and grade 7 through 12.
So are there any options for parents? Unfortunately, no. Doctors cannot give medical exemptions because of a parent's personal beliefs. However, other alternatives to consider include homeschooling or independent study.
Although there have been opponents to immunization, the goal of vaccination policies such as SB 277 is to produce immunity to preventable diseases. Experts say that 92 to 94% of the population needs to be immune to a disease like measles to achieve herd immunity to protect the whole community. Therefore, opting out of vaccinations puts children and the community at unnecessary risk to diseases. And despite overwhelming evidence that vaccines are an essential public health measure, a number of unvaccinated children in California have been rising, partly because of personal and religious exemptions that have been easy to obtain. And this creates dangerously low immunity levels in particular schools and communities. For example, this past year, a measles outbreak began at Disneyland and sickened 131 people in California and affected them badly enough to require hospitalization, and infected 16 people in other states. And most of these infections were attributed in part to the disease being spread by children who have not been vaccinated. So in conclusion, the new vaccination law is extremely controversial, and supporters believe it protects public health, while opposers believe that it infringes on their freedom of choice. So many opposers are pushing for a referendum or choosing to homeschool their children. However, this puts their own child at risk along with other children and the community as a whole. Moreover, public health policy like SB 277 are important in preventing and eradicating preventable diseases.